Everyone's talking about AI replacing doctors and healthcare practitioners, but in sleep medicine, the opposite has happened. AI has actually made my role more important. So let me show you what I mean. I'm Dr. Nishi Bhopal. I'm a psychiatrist and sleep physician, and I'm someone who's spent 2025 navigating a very different clinical landscape than the one I trained in. And if you're a clinician watching this, you've probably seen it too. 2025 was the year that AI became unavoidable in medicine. AASM, the American Academy of Sleep Medicine, actually released new guidance on how to use AI in our practices. Those consumer-grade wearables like Oura Ring, Apple Watch, Fitbit, and so on have become more accurate. Telehealth and home sleep studies have become commonplace and expected and normalized, and public interest in sleep has exploded. There have been headlines about long-term melatonin use. There's an increased demand for sleep apnea testing. There's lots of sleep hacks on TikTok and social media, and so much more. But none of this has mattered as much as what I'm seeing show up in my clinical practice. Now what I'm seeing is that patients are showing up with not only social media generated diagnoses, but AI generated diagnoses. They might run their symptoms through ChatGPT or Gemini or another AI platform, and they'll pull out sleep reports with all these arrows and warnings and interpretations that weren't exactly clinically correct. You may have seen this too. That moment where your patient or client says, well, AI says I have this sleep disorder. Gemini thinks that I'm not getting enough REM sleep. So 2025 for me has become the year of reframing, not just how I use AI, but how my patients use it and how I speak to them about it. And the great paradox here is that with all of this new information, with patients now having access to all of these AI tools and these wearables and all of this data, it's actually creating more confusion and more anxiety and worry and concern in my patients. And so I'm having to navigate a lot of that with my patients more so than ever before. Another big shift is a greater boom in wearables. A lot more of my patients are using Oura Ring or Apple Watch or Fitbit to track their sleep patterns. And there's also all these apps out there nowadays for tracking a variety of different types of health metrics. So in my practice, it seems like everyone is tracking something, whether it's their sleep or their menstrual cycle or their blood glucose or other types of metrics. So one of the most common concerns that I see as a sleep doctor is patients being worried about their sleep staging. They might say things like, my deep sleep looks terrible, or I'm not getting enough REM sleep. But as you know, even the most high-end wearables are still estimates. They are useful for tracking trends, but they're not great for sleep staging, and they're not a substitute for medical-grade sleep studies. Another thing I'm seeing in my practice is what I call sleep score anxiety. So patients might look at one low sleep score, one low number, and now assume that something is wrong with their sleep. Then what happens is they try harder to fix their sleep. That makes them more hypervigilant, and it feeds that vicious cycle of insomnia and sleep anxiety. So AI didn't create this anxiety, but it certainly has amplified the amount of input that people now receive without any guidance on how to effectively interpret and utilize that information. So it's not all bad news. AI can actually be helpful when we shift from nightly snapshots to longitudinal trends. It can be helpful to screen for sleep apnea, identify sleep patterns, and to help open up more meaningful conversations and dialogues with patients. What I'm seeing is because of this increased information and the awareness around sleep, patients are more open to pursuing evaluations, to getting sleep testing, to digging a little bit deeper to see what's going on with their sleep, and to engage in treatment. So what I tell people is don't ditch the wearable or don't ditch the AI, but learn how to use it wisely. This is more relevant and important than ever for clinicians. One of the tools that has changed my practice workflow a lot is using the sleep image device. This is an at-home sleep testing device that offers longitudinal testing, and it looks like what you see here. It's just a ring. It's quite small and it's easy to use. It allows you to get multiple nights of testing, so not just 1 or 2 nights, but 30 plus nights of testing. It's been especially helpful for patients who have variability in their sleep, and we know that sleep apnea fluctuates from night to night, so you might not capture it on a 1 or 2 night test. Also helpful for patients who have sleep fragmentation, upper airway resistance, and just to kind of get a closer look at what's going on using a medical grade device. As you can see, there's a lot to learn when it comes to clinical sleep medicine, and we're just scratching the surface in today's interview. If you are a physician or a health practitioner who wants to learn more about clinical sleep medicine in a practical way that you can use in your everyday clinical work, then get my free sleep mini course. I'll put the link to that in the video description below. You can also get it at IntraBalance IntraBalance.com/doctors. So I haven't stopped using polysomnograms. There still is a role for testing with a PSG, but this type of device is much easier for people to use as a screening tool, and it has a lower barrier to entry because it is so small and unobtrusive, so most patients are willing to give it a try. 2025 has also pushed me to expand how I treat insomnia. So a major shift in something that I'm really proud of is launching the Effortless Sleep Program, which is my online program for patients with insomnia. And it blends CBTI, which is cognitive behavioral therapy for insomnia, and ACT, which is acceptance and commitment therapy. And this grew out of what I was seeing with patients every week, is that more and more people are struggling with insomnia and sleep. And even more than that, they're struggling with their relationship to sleep. There's more rumination, more hyperarousal, more pressure to perform sleep. And all of that has become amplified by these wearables, by the data, by AI, and the growing awareness and media conversations around sleep. At the same time, there's more research coming out showing that ACT-based treatments can be non-inferior to CBTI, especially for patients with cognitive and emotional hyperarousal or comorbid anxiety, which I see a lot of in my practice as a psychiatrist and sleep doctor. So this Effortless Sleep Program that I've developed online, it brings together the rapid behavioral changes of CBTI along with the acceptance and psychological flexibility of ACT in a way that patients can implement consistently. We're seeing this reflected in the outcomes of our participants who've gone through our program, including those who previously dropped out of CBTI. This has really been one of the most meaningful evolutions in my practice in 2025. And because this is an online coaching program, we are able to see patients in any location. So if you have patients who are struggling with that cognitive emotional hyperarousal and chronic insomnia, we would love to support them in the program. One of the fears that I hear from other clinicians is they're worried we're going to be replaced by AI. But what I'm seeing is that even with more AI and more data, more wearable, patients need us more than ever. They need interpretation. They need us to help put that information into context. They need a lot of reassurance and guidance. They need psychoeducation and sleep literacy. And they need someone who understands what's going on with them, to separate the signal from noise, to figure out what's actually meaningful in all of that information that they are receiving. AI is a really great tool at summarizing symptoms, analyzing data, spotting patterns, but it can't read your patient's emotional cues. It can't interpret their subtle facial expressions, their body language, how their voice sounds. It can't treat hyperarousal, which is one of the things that drives chronic insomnia. It can't build therapeutic alliance and a true healing relationship that you can with that human touch. AI isn't a tool that is replacing you, but it is a tool that is going to reshape your work, and learning how to use it is going to be a crucial skill. So the AASM's updated statement for 2025 made this really clear, which is that AI is a partner in your clinical work. It is not a replacement for you. You as the physician or the clinician are responsible for the interpretation, the ethics, the context, and the patient-centered application of that information. So this framework presented by the AASM encapsulates perfectly what I've been experiencing in my clinical practice this year. In 2025, I found that a new part of my job is now asking patients things like, what did your wearable data show? How did you interpret that? What did ChatGPT tell you about your symptoms? So not only am I a physician guiding my patients with their sleep issues, with their mental health, but I'm also a translator and a guide. I'm doing a lot of myth busting and trying to help patients cut through that noise to make sense of a world with too much information and not enough perspective. Looking ahead to 2026, I think we're going to see better wearable validation. We're going to see more hybrid AI-supported sleep care and overall clinical care. We're going to see more longitudinal home sleep testing and a greater need for clinicians who can integrate all of this thoughtfully. So this technology is going to keep evolving, and you're going to be seeing more and more of it in your practice. So if I had to sum up 2025, I would say that AI did not replace the clinician, but it has changed the questions that our patients ask, and it's changed how I support them. When you use it wisely, AI can expand access, it can deepen insights into patient sleep issues, it can open up more patient conversations around supporting their sleep health, also about their lifestyle, their overall health and well-being. But patients still need a human to guide them and to provide high-quality, personalized care. So that's where our work continues to matter the most. If you want to deepen your sleep medicine skills, go ahead and subscribe to this channel to keep on learning. And let me know in the comments, how is AI showing up in your practice?